We have not discussed exactly how the federal government, the DOJ, the Drug Enforcement Agency, uh, the insurance industry, who's really at the head of these investigations against doctors, what they use to determine if a doctor's not following the rules. Uh, this all started heavily back in 2016 with the initiation of the HFPP, the Health Fraud and Protection Partnership, which is a means of investigating doctors to look for fraud and abuse and for misprescribing things like that. What they use is this entity called Clarent. Clarent is a data analytics company. They did not they've existed for a while. Traditionally, they look at companies, big companies. They look for, I guess, fraud. They look, I guess, for things like are they providing services that they're charging for, and are they misusing the money, etc., and so forth. Again, I'm going to be honest with you. I don't know too much about the company. I just know some basics. Okay. The government sought their services. Uh, this company has no experience with healthcare. Uh, no, has no medical experts in their staff, and in fact, the data analytics is not scientific. Okay, the data analytics they use against doctors is the same data analytics they use against big companies. Uh, the problem with healthcare, with treating disease, is that, like the Supreme Court said in Linder versus USA, and in the recent Ruan versus USA decision of 2021, that we all differ physiologically. I may have a 120-pound person on 300 milligrams of Tegretol 3 times a day for epilepsy, and it controls their seizures, and a 200-pound person may only need 200 milligrams. We're all different physiologically, and that's pretty much common sense, and the Supreme Court made that clear. You can't take a bunch of information uh, and just draw a conclusion. And the information they use is mostly from PROP, Physicians for Responsible Opiate Prescribing, which is spearheaded by Dr. Kolodny from Brandeis University. This doctor is your classic white privilege. He has no knowledge, uh, of what he's talking about. He says that you should not go above 90 milliequivalents of morphine equivalent. He admitted, as others have indicated, that there is no scientific data to support this. This is something he just says out of his head. He claims that back in the 2000s that there was a rapid rise in the abuse of heroin. That this was mostly due to patients who were taking prescription opiates. Not only is that not factual, he knows that's a lie. Because if you look at the data, first of all, only 5% of the public, 10%, 5%, depending on who you read, abuses opiates when they're prescribed, okay? Uh, but most of those people do not get them from doctors, they get them from the streets. So in reality, you're talking more like 0.5%. So these people, if there were some that started off with with prescription, and went on heroin, these were people who were genetically prone to addiction. Addiction is not just about opiates. I call it the opiate gene. I call it the addiction gene. We have not identified that gene. Okay, all we understand is that these people crave dopamine. Dopamine is your pleasure hormone. Happiness is different. That's serotonin. Immediate gratification is dopamine. Pathological gambling, sex addiction. These are all examples of people who rely on dopamine. Problem is they live for the moment, okay? They don't live for, happiness is going to a food bank and helping feed people, poor people, giving them Thanksgiving dinner. That will not burn out because you got that gratification for life, as opposed to whether you're talking money, whether you're talking drugs, you need it more and more repeatedly. And I don't want to get into the science, but over time, The dopamine receptor is burnt out. You need more and more and more and more, and you live like a lizard. They call it the lizard model. Okay. Some people, for some reason, are more prone to needing this gratification than others. We know that. Okay. And again, Clarent does not place emphasis on that. It's all based on just data analytics over what one person said, and that person is Andrew Kolodny. Mr. Kolodny has no experience, uh, no scientific knowledge of anything having to do with the chronic pain model. He doesn't even know what chronic pain is. Everything that he says is non-factual. Now, so again, doctors are going to jail based on what he says. Uh, he may have a person, let's say, I had a patient with a fungus ball from New Mexico. I mean, aspergillus. I mean, some of you know what that is. And that stays with you, and it causes horrific chest pain. He required 800 milligrams of oxycodone a day. That may be shocking to you guys, but again, opiates do not have a ceiling effect, meaning that uh, you look at how drugs work. They work within a therapeutic window, a specific dosage, okay? You go below that, you get no effect. You go above that, you get toxicity. And that differs from person to person depending on their physiological genetic makeup, okay? Opiates do not have a ceiling effect, meaning that as long as you go slow, you don't have liver toxicity like you do with anti-inflammatories, or with Tylenol. You do not have you do not have kidney toxicity. They don't cause any of that. Ironically, opiates are very safe, okay? But I don't know what gives with this Dr. Kolodny. He has an anti-opiate thing, and look, all drugs have potential side effects. Ironically, opiates have less side effects, potential toxicity side effects when we're talking about organ damage than any others. You see heroin addicts from back in the, I don't know, 60s who are now 80, and they're fine. They just got over their heroin addiction. But now, what's most shocking, what's going to be most shocking to all of you out there is that Clarent doesn't just look at doctors. Okay, when they're looking at doctors, they do not get a warrant. There is no warrant. They just pick the doctor and investigate them, which violates the Fourth Amendment. Now, this is going to shock you even more. They're doing it to you. They go into the public, they look at the records, they look at what they're on, and if that person has ever taken an opiate, they red flag them. You go to a pharmacy or a doctor, next thing you know, if you broke an ankle, they won't give you anything for pain. So, what's happening to doctors with them using this ridiculous Clarent algorithm is not, they're not just looking at doctors, they're looking at you. You need to be aware of that, okay? So again, the more you learn. Have a great day.